Now when it comes down to treatment, if we're just focusing on the upper cervical region, I think the best thing to do is just take your ball and do a little self-massage. There's a lot of different trigger point treatments, but they're kind of tough for this area. If you have a medical practitioner, physical therapist, chiropractor, someone that's familiar with trigger point treatments, it can be great for them to get in there. For you, what I would say is take the ball, you get into this spot that's tender in the upper cervical region, could be over here, and you're just gonna work that out for a couple minutes. So pretty much what you're doing is you're just pinning down that spot with the ball and you're just kind of working it out, right? 2 minutes, bare minimum. It should be relatively comfortable, no more than like 5 out of 10 discomfort with this. And as you're going along, you should feel like it starts to relax or release a little bit. Okay, so besides for the self-massage for the suboccipital or the upper cervical region, what you can do is you can get something like this. So this is called the Gemini. Pretty much the original concept was just 2 lacrosse balls taped together. I tend to find that my patients love doing this, so I tend to recommend it. We take this, we set it up right in that area in the suboccipitals. You go ahead and lay down. And from here, all you're doing is you're just kind of searching and exploring. So if you come a little bit closer, you'll see all I'm doing here is I'm just kind of working out these tender spots. The other thing you can do is you can go ahead and work on your chin tuck in these positions. So you'll get in this spot, you'll pin it down, and you'll just go through doing a little extension, a little chin tuck. The idea with this is you're not only mobilizing the tissue, but now we're starting to mobilize the joint. If we can get the joint moving a little better, that means the neck's moving a little better, and we're feeling better. All right, so same thing, we'll go through that for at least 2 minutes, trying to feel like that area relaxes. All right, so after you do some of your soft tissue work, a good thing to do is you can go ahead and start working on stretching. So a lot of times with different medical providers, we give you different advice on how to stretch, but the idea here is just to get a gentle, relaxing stretch and just to feel like that area calms down a little bit. So something I would recommend for these upper cervical areas is that you just come down, right, applying a little bit of overpressure with the hand, and you just hold the stretch position while working through some deep breathing. When you're taking that breath out nice and slow, right, so we'll do 5 seconds in, couple second hold, and then 5 seconds out, you should feel like gravity is taking that head and that muscle is just relaxing. So I'll demonstrate. So let's say this side was a little tighter when you did your rotation test. You'll come down. And from here, I'm just taking some deep breaths. I'm feeling like gravity is taking this, and I'll hold this for 30 seconds to a minute, and I might repeat it 2 to 3 times. So the next stretch is a contract, relax stretch. The idea with this is we're actually starting to incorporate the muscles, and we're trying to kind of lock down that new range of motion that we have. So let's say that you're trying to do the rotation flexion stretch. So we came down, we did a little gentle stretching. Now what you can do is go ahead, you'll rotate, you'll come down. When you hit the barrier, what you'll do is you'll go ahead and you'll give yourself a little pressure at the forehead in an effort to contract those muscles in the front. After about 5 to 10 seconds, you'll try to go down a little bit further. Right? You'll hold this for about 2 deep breaths, and then you'll go down, you'll push again, 5 to 10 seconds, about 20% effort. Right? You'll go down a little bit further, cycle a couple of deep breaths here, and then you might repeat again. So we'll normally do that about 3 to 5 times. You can add that with any stretch. Right? It could be bending to the side. When you hit your barrier, you'll add a little bit of pressure, a little resistance, then you'll relax and go a little bit further. Right? You could also add this to a position here. Right? You could do the same thing with stretching the neck backwards. Have fun.